160. A head nurse of an intensive care unit wrote a report about the needs of her department and gave it to the nursing supervisor. Which of the following types of communication is this? 1. Upward. 2. Horizontal. 3. Diagonal. 4. Downward. The answer is 1. Upwards. 161. A head nurse of a coronary care unit delegated staff scheduling to a senior nurse in that unit. Which of the following steps must the head nurse implement before delegating tasks? 1. Negotiate with the senior. 2. Take signature of senior. 3. Explain task to senior. 4. Make sure hospital policies for delegating tasks. The answer is 4. Make sure hospital policies for delegating tasks. 162. A 45-year-old patient has a colostomy bag attached as a result of benign mass removal. While conducting the discharge teaching session, the nurse assessed the patient's wife's understanding of the teaching. Which of the following steps of nursing process is exercised here? 1. Implementation. 2. Planning. 3. Assessment. 4. Evaluation. The answer is 4. Evaluation. 163. Which of the following is correct nursing process order? A. Diagnosis, assess, plan, evaluate, implement. B. Assess, diagnosis, plan, implement, evaluate. C. Evaluate, assess, plan, implement, diagnosis. D. Plan, assess, diagnosis, evaluate, implement. The answer is B. Assess, diagnosis, plan, implement and evaluate. 164. A nurse calls a physician regarding a change in a patient's condition. A physician gives orders over the telephone for stat arterial blood gases. Which of the following is the best intervention to be implemented? A. Give order stat to health unit coordinator to input in computer. B. Write down order and read it back to physician. C. Write down order for ABGs immediately. D. Call respiratory therapist stat to draw the ABGs. The answer is B. Write down order and read it back to physician. 165. During cardiopulmonary resuscitation, CPR, for a 75-year-old man in the emergency department, the doctor introduced himself as a leader for the CPR. What is the most appropriate leadership style for this situation? A. Autocratic. B. Democratic. C. Bureaucratic. D. Laissez-faire. The answer is 1. Autocratic. 166. A nurse manager is open-minded, listens to the team, understands others, makes changes to improve unit operations and procedures. What type of leadership style is this? A. Situational. B. Democratic. C. Compassionate. D. Transformational. The answer is B. Democratic. 167. A nurse manager includes staff in decision-making process. What unit structure is used? A. Divisional. B. Centralized. C. Functional. D. Decentralized. The answer is D. Decentralized. 168. What is the main limitation of democratic style of leadership? A. It ignores the incompetent personnel. B. Cannot be used in emergency situations. C. Decreases collaboration among the team. D. May end up in inappropriate decision-making. The answer is B. Cannot be used in emergency situations. 169. A nurse manager is preparing and writing a plan for dealing disasters, code red. Which procedure is the top priority for the nurse manager? The plan. A. Infection control. B. Staff orientation. C. Patient education. D. Patient relocation. The answer is B. Staff orientation. 170. Nurse manager was not happy about low results of patient survey. Which of the following is the first step for nurse manager? A. Schedule meeting with staff. B. Start changes to improve. C. Review evaluation details. D. Report to director. The answer is C. Review evaluation details. 171. A 14 nurse manager assigns tasks according to clinical competencies of the nurses. Which of the following is the management function? A. Delegating. B. Evaluating. C. Planning. D. Controlling. The answer is A. Delegating. 172. Postoperative patient who underwent an abdominal procedure requests a pain medication from the nurse and rates the pain at a level 9. There is a standing order for narcotic administration. When the nurse opens the narcotic box and performs a count, the number of pills remaining in the box is different than the number of pills recorded on the sheet. What is the most appropriate initial nursing action? A. Notify the nursing supervisor. B. Write the finding on the narcotic sheet. C. Administer the patient's requested medication. D. Identify the last nurse who used the narcotic box. The answer is A. Notify the nursing supervisor. Check vitals and inform physician. 174. The nurses in the male medical unit took a signature on the from a patient who needs an abdominal CT with contrast. What is the best nursing practice? A. Consent should be taken after the procedure. B. Verbal consent is acceptable for this procedure. C. Consent should be taken from the patient's relatives. D. Consent should be taken according to the organizations. The answer is D. Consent should be taken according to the organizations. 175. In the hospital digital dashboard, what types of data are displayed? A. Staffing. B. Financial. C. Performance. D. Knowledge-based. The answer is C. Performance. 176. A newly nursing director assigned to a hospital. That is the first should he do? A. Evaluates the staff. B. Change the head nurses. C. Change the roles. D. Nothing to do. The answer is A. Evaluates the staff. 177. Surgeon instructs a nurse to serve as a witness to an elderly patient's informed consent for surgery. During the explanations to the patient, it becomes clear that the patient is confused and does not understand the procedure, but reluctantly sign the consent form. The nurse should A. Sign the form as a witness, making a nation that the patient did not appear to understand. B. Not sign the form as a witness and notify the nurse supervisor. C. Not sign the form and answer the patient's questions after the surgeon leaves the room. The answer is B. Not sign the form as a witness and notify the nurse supervisor. 178. A community nurse assigned to work in Mecca, one of the most multicultural cities in Saudi Arabia, has to interact with multicultural population every day. What is the most important step the nurse should do before with the clients? A. Asking the client about his/her cultural background. B. Conducting an appropriate culturological assessment. C. Ensuring that the client has his/her privacy. D. Looking at the client's file to take history. The answer is B. Conducting an appropriate culturological assessment. 179. The head nurse meets with staff nurses to discuss ways to improve communication among shifts. Which of the following statement best exemplifies the final stage of conflict management? A. We need to clearly define the nature of the conflict. B. I will evaluate the outcomes of the strategies used monthly. C. Let us create a timeline for the implementation of our strategies. D. I have to force you to follow the rules to resolve the issue. The answer is B. I will evaluate the outcomes of the strategies used monthly. 180. The head nurse of a coronary care unit delegated the staff a senior nurse in that unit. What initial step must the head nurse implement before? A. Check the hospital policies for delegating tasks. B. Explain the task to the senior nurse. C. Negotiate with the senior nurse. D. Take the signature of the senior nurse. The answer is A. Check the hospital policies for delegating tasks.